afternoon, and thank you for joining the Alabama Coordinated Health Network eBook training webinar. My name is Summer Macias with Alabama Medicaid. Before we get started, I have some housekeeping items to go over. First, will all participants have been placed on mute, so do not unmute your phones or microphones during the presentation, just to avoid disrupting the presenter. Second, we ask that participants enter their name through the chat box function for attendance purposes. If you have joined us by phone only, please submit your name and organization to ACHN@medicaid.alabama.gov. Third, you may enter questions or comments in the chat box at any time. And if you have joined us by phone, you can submit questions to the ACHN@medicaid.alabama.gov. Our presenter for today is Dr. Thotakura, Medical Director with North Alabama Community Care. Dr. Thotakura will present the ebook, which he developed along with the North Alabama Community Care staff. So I will now turn it over to Dr. Thotakura.
Thank you very much, Dana.
Do you have the same?
Good afternoon, everyone. One sec.
Good afternoon, everyone. My name is Charlie Evers, and I'm the president of the third year class, and I'm an MS3.
I hope it is not as cold for all of you. It's a good January 26th, chilly here. This afternoon, I'm going to talk a little bit about the ebook. This is developed here at North Alabama Community Care with me and my team. I would start with our Executive Director, Dana Stout, who has been very helpful in putting us forward and work this out. And Emilia Reja, she's the Quality Program Director, and she has actually put this into a form and shape that we all can see this and look what it has done. And also Laura Thompson, who has been helpful from various points with us on this. So without much delay, let's get started what we have in here. The ebook is meant to be a desktop site for all of us, those that are in practice as providers to take care of the Medicaid patients. Whether we are pediatricians or delivering OB doctors, family practitioners, whether you're in private practice or in medical school or in health network, healthcare situation, federally qualified centers, whichever situation we are in, I think it's going to be of tremendous benefit. Now, it also is helpful for all the ACHN to have it on their desktop. And I'll tell why it is so important as we go through. I believe in communication. Communication helps us to understand each other. And the same way an organization needs communication, just as individuals need communication. The organizations will express their goals, their objectives, and the means how to reach there. And we have various resources in the state through our Alabama Medicaid Agency. And I really mean it. We do have many resources. And I feel at times not being connected, not being presented in the way that is appreciated, I feel we may not be doing the best we could. And so any improvement to close that gap or the hole is going to help us to take care of the patients and to improve the care that we do on a day-to-day basis. And this ebook is to improve that, to enhance the communication of what the organizations are doing, what the providers are doing, how we are going to help our patients. So that is the goal, and I sure hope we all find it useful as we go. So that's a little forward that I put in there, why it is where we are. And I also want to thank Alabama Medicaid Agency for their strong support in this. Without their encouragement, we wouldn't have been able to do it. That's Salisa, who has helped a great deal, Drew Nelson, Barry, Cameron, everybody has been very helpful on getting this out. And I know the information at the end, they have approved and they have made a little minor tweaks, and that has helped to make this look good. So this ebook is divided into various sections, 10 sections. And the first one is the table of contents. It's basically an index, and it shows what we have available here. The first one is introduction. That has from page 5 to 10. Then the provider participation requirements. That's page 11 to 13. Then we have provider participation agreements. That's page 14 to 15. Then we have Medicaid recipient eligibility and covered services. It is not only about the providers, it is about the recipients whom we actually take care of them. So that's, we talked a little bit, we wrote a little bit on that. And after that, we go into the providers, the PCPs, that has taken several pages, 23 to 37. DHCPs, 38 to 47 pages. And you can see in each of this section, there are subsections. So when you're looking at it, you don't have to go through all, you can go and reach to what you're looking for. Then the family planning services, that is from page 48 to 49. BMI, which we talk a lot about, and the requirements and the coding, it's page 50 to 53. Then pharmacy. Now, this I think is going to be a very useful tool because it does give the preferred drug list and other programs in the pharmacy. That's page 54 to 55. Lastly, the most important is Alabama Medicaid Agency. That's page 56 to 57. I say most important because it has all the links. It has all the links to reach to the information that we need. Now, this is all about 57 pages. Now, you may wonder how in the world you're going to have so much information in 57 pages. But the secret here is it has the links in various places. The links takes to sometimes thousands of pages that Alabama Medicaid Agency has been doing all this and in various forms. So we can actually go in and see what's the policy, what's the procedure, how to do, what to do. And at the end of the day, if we still cannot find, there are various ways we can reach. We can reach out to our ACHN, we can reach out to these, the numbers and the people that are already in the website where we can reach at a particular point when we are stuck. So instead of feeling helpless, instead of feeling like we don't know how this works or what to do, there is a way to find out. So that's what I would like you guys to use this. Now, if we start to use it on a day-to-day basis or as we needed basis, we get more familiar. And as we get more familiar, there are a lot more things we can do in this. We can actually have this as a question and answers form in interactive, where if you have a question on something, you can send a question to your local ACHN, they can reply to you. We can have that. We can also have like a chat box. Those are all not there now, but those can be added if there's a lot more interest and if it becomes a practical tool. And I sure hope it becomes a practical tool. So let's go to the next what I want to show you is the introduction part. So now this is just like a basics. It's not like we need on a day-to-day basis. Here is how I look at it. If you have a guest into your house, you want to welcome with whole heart and do a good impression, a good first impression. Now, the reason I put this out introduction is I want, I expect over the years several hundreds and maybe thousands of doctors join in Alabama Medicaid Agency. And I want them to see firsthand what they can get out of this. This gives a little synopsis of what it is, how this works. And so those of us who are already swimming in this, we may not be finding it as useful, but I think it is useful for the newcomers. So that's a little bit about the AMA, Alabama Medicaid Agency, a little bit about ACHN, which is the predominant thing about this ebook. It is about the ACHN and how we do what we do here. So it talks about ACHN. It talks about how the ACHN is governed, how the governing board members are picked, and what is their role. And also it talks about the Consumer Advisory Committee and who are these and how it's comprised and what are they supposed to do and how their information gets into these board meetings and how it gets to implement in doing what we are supposed to do. Now, as you know, ACHN is divided into many regions, and each region has so many counties. And so all these 7 entities are listed here, and this is the state map. And you should be able to click the county and get the number, the contact person of that ACHN. And here are the counties. You can click and you can see which county belongs to in which ACHN. And here is the information on ACHN contact information, their phone number, faxes, email, and website. And some of these are not clicked directly going into their website, but the idea is that when you click, it should go into the website of that ACHN. That way, ACHN also can put their information, whatever they want to do. Let's say it's the month of February. We want to say we would like to work this month on, getting, asthmatics, getting their medications, controlled medications, and talk about it. So you can use that month as the asthma month. They can highlight that and have that go into their provider base. And you can pick up in June, back to school, shots, checkups, whatever. That kind of gives a little interactive communicating mechanism here. Now, these are the care coordination services ACHN does. And this is by no means a complete list, but it does indicate several things. But if you have any doubt whether a particular care coordination can be done or not, the best way to find out is call your local ACHN for clarification. But this is all the list that we have. Now, we talk about providers, who are they, how they participate. I talked before of new ones, how we want to welcome. So here is a little information on how they can join in Medicaid, how they can join to be a primary care provider, how can they join in ACHN. Same way DHCP, how they can join in Alabama Medicaid and how they can join in ACHN. So it talks about the requirements. So it's very easy for the office manager to scroll through and see what needs to be done and get the application forms. And you can, there are some links here. You can get the applications that you need, the agreement forms, and fill them out. And if you have any questions, you should be able to get that clarified. So then you have these agreements. So what agreements you sign? As I said, PCP signed 3 to join in Medicaid, to join as a PCP, and to join as ACHN member. And delivering healthcare professionals join as a Medicaid member and they join as ACHN members. So, and again, you have the links to get the information, further information and the papers that are needed to fill. This one is Medicaid recipient eligibility and covered services. And I find it useful because sometimes we have patients that go from private insurance, they need to go into Medicaid because of their changing economic situations. Sometimes we have patients move into the new city, they ask questions. There are various reasons why we, the providers, also need to be knowledgeable how our patients are picked, how they're eligible into the Medicaid system. So it talks about who are those that are eligible. As you could see, eligibility categories. And then there are also some that are excluded. So that also is listed out here. And then you have steps, how you confirm if one is eligible or not. We have patients come to the reception desk and say, I have Medicaid. And so you want to verify, and how do you verify that? You want to get their Medicaid card. Sometimes if they're new, they may not have in hand, but they may have a letter. If it's a newborn, they may have initial letter, but it may take a couple of months to get it processed and get the information. So we do not want to deny the care if they actually are eligible. And so we want to work with, and there are 12 numbers in the Medicaid. Occasionally I have seen sometimes they have written down their numbers, but not necessarily have the card because they're in a hurry or mom or dad is in a business trip. So we work out on those and try to get to the site and see if they're eligible or not. There are electronic means you can check. There is a software that's available, provider electronic solution software. There's automated voice response system. So there are different ways you can get that information. So you get the the recipient number, you get the plastic ID card, you see the proof of eligibility, and then you want to know what type of services are covered. And we often know, but when it comes to medical care and treatments, we would know. But there are other areas that Medicaid does that we may not be directly providing that care.
Right now, he's just showing
Transportation,
it's not really much.
dental services, eye care services, family planning services, preventive health education, hearing services, home health, hospice, hospital services, lab and x-ray, outpatient care, maternity care, mental health services, nurse midwife services, nursing home care services. Of course, it may not be something that we as primary care providers deal with on this, but it is definitely useful to know. And if someone is in the out of state area, how that affect, those services on an emergency basis. And so those are something it's helpful. And prescription drugs, this always gives a hiccup to us, is this covered or not? And you don't want the patients to go to the pharmacy and then discover that that is not covered. So again, knowledge is good. And renal dialysis and transplant services. It also talks about what is not covered. Oftentimes patients ask for cosmetic surgery or sex transplant changes and, dental, orthodontic care and others. If we know, we can answer those questions. And, age 21 and above, some services are not covered. And so that's the useful information. Going on to the next one, which I think is most important, is the primary care providers section. And as it is more important, I have allotted a lot more pages, 23 to 37. So, and we covered in this, under this provider selection and referral requirements, reimbursements. Now, as you can see, you can click on those and go to the billing manuals, provider billing manuals, and get that information. The beauty of this ebook is not only what you read on this ebook, but from the click, what it takes you to and what information you can get. There's a wealth of information. Even I, practicing for almost 40 years, I still found a lot of new information, and I'm sure there's still a lot more to learn. So that's a reimbursement on payments, and this is on patient attribution. You know, we don't have assigned patients, but we have attributed patients. And attribution is based on how the patients are using their services, where they go for their primary care, where they went for their checkup, where they got their last prescriptions filled. So based on several factors, a patient is attributed to a particular provider. And that is very important for various reasons. One, you feel that patient is your patient and you take care of not only for that episodic care, but you take care of the whole sum. And also, Medicaid keeps track along with ACHN on how to work with the incentive program. And the incentives are based on how many you have on attributed list. So that is important. Then we talk about quality improvement. Quality improvement, each of the ACHNs may have a different quality improvements that they're working on. But we have the childhood obesity, infant mortality, substance use disorder as the primary ones that we are working on. And we use the care coordination services to work with. We use the quality control department at the ACHNs to work with. And we work through the medical management meetings to see how we can improve the quality here. And as you know, why obesity is so important, you know, it affects not only the children, it affects as they grow older in many ways, you know, to the heart, to the brain, to many different ways. So if there is something we can do as, especially as pediatricians, to raise a healthy child is to make sure that they're not obese. Then we have the infant mortality. We work with the DHCPs on how to lower the infant mortality. And our governor has worked with various agencies with the early childhood education, human resources, mental health, public health, Alabama Medicaid Agency, and Alabama Office of Minority Affairs, with all these to address the problem of infant mortality. And if we have a, you know, well-managed pregnancy, we sure hope to have a good outcome, and that is critical. And preventing low birth weights in Alabama is our main goal, one of the main goals. Next is substance use disorder. As you know, we're always listed on one of the highest on the list of the substance use disorders. Alabama is one of the ones that where we have a lot more room to improve. And so there is a lot of emphasis on this at various levels at Alabama Medicaid Agency, at ACHN. And so we need to pay attention to this and see how we can improve. Then we go into the quality incentives. Of course, we always like to work hard, but we also like to have some incentives, right? There's nothing wrong with that. And so we have different forms of incentives. There are quality incentives, there are cost effectiveness incentives, and there are patient care centered medical home participation incentive. They're divided like 50% for quality, 45% for cost effectiveness, 5% for patient centered medical home. So this talks about, these pages talk about how that is structured. And what are those measures under the quality measures? You have those 8, 4 for children and 4 for adults. And it talks about when we get payments, how these quarters are divided, and when we actually started to get payment based on our actual results. In the past, when we started out ACHN, we didn't have the record prior records, so they have grandfathered to have everyone get it. But now we have to earn. We have to work on it. And I understand there are frustrations from some doctors that we work hard, but we don't seem to see that incentive in our hand. And again, knowledge is important here. I understand the frustration, but I can see why people are frustrated. But if you understand how the system works, then we know some of the things it may be beyond our control, but there certainly are things that are in our control. And that's where I think we need to focus on how we can improve that. So it talks a little bit about what's the importance in participating in ACHN. As you could see, there's a bump rate, which is higher, right? And then ACHN participation gives a little higher. As you could see, under each of those codes, there is a higher reimbursement for being in the ACHN. I understand being in ACHN requires participation in the medical management meetings, participation in the quality control and all these measures, and referring patients for care coordination, but there is some extra remuneration, not only in incentives, but actually day-to-day billing and reimbursement. So please keep that in mind. So that's that information. Now, here is the information on quality measures and cost effectiveness scorecards. You know, we all like to see how we are doing, and I think each one of us needs to be quite familiar with how to access our own provider web portal. That is with our user ID and our own password. And I know our office managers do, and if we also know, we can access this. And here are the steps how to do it. You need to go into the secure site. You need to go into the trade files, download those that are highlighted, and that gives your scorecards, and it compares to how, you know, where we're supposed to be and where we are. And it talks about all the different patients, how they impacted our score being high or low. So you can monitor that if you want to. Once you understand how that works, then you can monitor better. So then there is this MARA scoring. It caused a lot of uproar when we had the first cost effectiveness incentives sent out. Oh, I take care of all these difficult patients. I work very hard. How come I'm not eligible? So MARA scoring is relative scoring. How our patient population is comparing to the statewide population. And that's, we get a factor to calculate into our patients. If we have difficult patients, if we have multiple diagnoses, if we are doing you know, more than just doing checkups, those patients have higher score, and higher score in your patient population means you may spend more, but still you will be eligible. So get familiar with all this. This may not be a forum to discuss in detail on this, but there is information out there. And I'll come to that at the end to tell, but each of these actually have webinar presentations. They're done by the Alabama Medicaid Agency in various times in the last few years, and you can access them and learn more. So this is on the patient-centered medical home and how to get enrolled, how to do that. It has the information, whom to contact, email, fax, numbers. Now, there's lastly on the primary care providers, the medical management meetings. You know, it talks about how many you have to attend, how to attend. Of course, with this COVID emergency, we are doing webinar, but otherwise we need it to be 2 physically present and 1 webinar. But now, of course, 3 webinars in 12 months. And that talks about 12 months when it starts. You know, October 1st is when it starts, and September 30th is the last day of that year. Okay, then you have Medicaid agency required forms. So this is the library of the forms. You can click this and go. I can show you to click and see. I hope I can come back. Amelia, you may come and help me. So you could see we came to the Medicaid website. That's what I was talking about, the clicks and the links. So you can come in here and you get whatever information you want. Like, let's say Alabama Medicaid applicants. You go there and you get the forms you need. This is providers. If you get to the providers, you get to this information on different aspects. The manuals have a lot of information, but you can get into various sections. And here is the secure portal login that I was talking about. You can get it to see your scorecards. So this various information, and also there are forms section too. So back. Okay. Need to come out. Okay. Yeah. So that's how you click out and click back in. Okay, this is delivering healthcare professionals, DHCPs, and they are also ACHN members. I don't know if any of you are on this webinar, but there is a lot of useful information for them as well. What services are covered, the antepartum, delivery, hospitalization, and postpartum care, and what services are covered, radiology, home visits, family planning, and different services, emergency services, mental health services. So it talks about in detail of several aspects, and the care coordination and the quality improvement they participate in. Of course, would like to get all the pregnant women to come for the prenatal visit in the first trimester itself, and they get a bonus if the patient is seen by the delivering provider. And also, if the patients come for postpartum visit within that time frame of 21 to 56 days, they get another bonus on that. And all right, and it talks about those codes and how much they get reimbursed. And this is Medicaid agency is trying to keep up with our reimbursements, and they have in October made some changes to the delivering healthcare providers to increase their fee. And as you could see, this is the information. So you get all this information on the ebook. And so this is on family planning services. And as you know, who is eligible and who is not. It talks about how to get help, where to get help, and what kind of help they can get. Then we talk about body mass index, and BMI is, again, we all know why it is so important. And it's a requirement at this point that we do once a year. And if we do once a year, hopefully we all do at the checkup time, and it covers for that year. So we don't have to do that at the sick visits. If we don't have a checkup, and if we have a sick visit, and if we did not update the BMI, we may get into a problem. So here are the codes, which have the codes that need to have that information entered. And here are the BMI codes, CMS 1500 codes for children less than 20 years of age. And then you have for adults. So, based on their percentiles. Now, I feel this is most important also, the pharmacy preferred drug list. Because as I say, I often wonder, is this covered? Sometimes Medicaid changes from one medicine to another medicine. So we got to keep up with. It's nice. And they always bring it to the office so we know, but sometimes it is misplaced. It's not properly organized in some offices, but here you have it right at your desktop. So you can click that and you go to that site. Oh, it says temporarily not available. Hey, Amelia, can you? They may change. Oh. It worked for me actually when I tried this morning. Yeah, that one right there, but there's maybe click the lower one. That's fine. I'll get in a different site. Okay. All right. Then there is a pharmacy therapeutic preferred drug list. So it's a DME list. After that, we're coming to the last section, which is, I feel, is the most important because this is where the critical links are. Alabama Medicaid Agency website and presentation. Okay. You can select these and go to that site. Let me get that. Okay, so we got into the Alabama Medicaid website. As you saw, I just clicked and it brought me here. And as you could see in the newsroom, we have the updates, alerts. Go to the alerts section and takes sometimes a second. COVID-19 emergency expiration date extended to February 28th, 2022. So there are recent alerts and you can go back into the list of what we have. So as you could see, all those alerts are there, historical. So you can go back and see if you need to check some information. Then in the same area, you can get a lot of other information. You can go to the providers section and get to see all the information that I was talking about. And you have resources section, and in the resources section, you have all the forms. I'll just click that so you could see all the forms libraries here. You know, if you need a referral form, you need a EPSTT form, you have a billing form, you need a consent form, mental health form, maternity care form, whatever forms you need, you have them here. So that's a good resource. You get provider directory if you want to find out if you have in a particular county a doctor that would be able to see the Medicaid patient. And if you go to the ACHN, you can click there, or we are already in that site. So this is what I showed you before on the ACHN providers. And it has all that information there. And let me click that, learn more. And this is where I feel is very useful. I'll show you. This is the, well, as you could see, this is 126 now, the ebook. And if you go down the list, you have several program documents, you have program presentations. You can click and see whichever program you want to watch. Yeah.
Just 1 second. Sorry, guys. Like as we're sharing, no longer sharing his links.
Oh.
So now that should work. So when you clicked that link,
Oh, okay.
you just want to start from there.
Yeah. Well, let me show this. I'm sorry, I didn't realize that you're not seeing it, but let's do that. Okay, here is the Alabama Medicaid link. As you saw, I clicked there. It brought me into the Alabama Medicaid website. And as you could see, so much information is here. And that's the newsroom I was talking about. So you get the alerts. And if you go to the alert, and you could see, just a second. Okay, there you go. COVID-19 emergency expiration date extended to February 28th. Like that, you could see all the alerts and news. Then you go back out of that site and you come back to the ACHN. You can see all these programs that were in the past. So I was telling you before on the MARA scoring, and that's the brochure and the information there. And there's a presentation on that too. So you have different quality, understand the quality, how attribution to ACHN works, updates, manuals. So you have tons of information here. Okay. Come out. All right. Okay. Now, I failed to show that PDL. It didn't work before. You think, Amelia, you can click that?
I need to remove a space in the, you were looking for the pharmacy?
Yeah.
Okay. To remove a space in that URL, for some reason, when I transferred this over, so I just need to redo that link.
Oh, okay.
Oh, actually, no. It looks like the link has changed, so I'll just update the link.
Okay, all
and
right,
we'll be
we'll
good.
update that, but
Smooth.
that should come because that I think is a excellent information for us. Okay. Now, I think I covered the ebook, but now I want to show you what it is. It is Adobe Presentation, right? So you need to have that on your computer. And once you have it, you can click it and get to this. And it's easy to navigate. You have the bookmarks. I don't know if you can see the left on the computer screen. Are they able to see? Okay. So you can see all these sections that I was talking about. You can see at a glance all, not only the main sections, but the subsections in each of those. For example, in the quality incentives, you have ACHN bonus payment pool, PCP group bonus payment eligibility requirements, bonus payments for quality, cost effectiveness, PCMH recognition, PCP quality measures, quality bonus payments, like that. Each one is in there. You can click to that particular one and go to that. Well, let's say we go to the, that's where it takes you to that particular one. Well, let's say, no, I don't need this. I need some other. I'm going to look at the patient attribution. This is where it comes, patient attribution, how that works. And so you can go to whatever section. So when you look for an area, which area is in which one, you can see based on the color coordination, which one is in that county and in that ACHN. These are bookmarks. You can go to the bookmarks and get to condense it or make it bigger or smaller. So that's that information. And I believe that is what I wanted to cover. And if you have any questions, I would be happy to answer. And I really want to thank Alabama Medicaid Agency, North Alabama Community Care, my team, for helping me out and doing this what we can, and I feel is going to be useful. Thank you very much.
Thank you, Dr. T, and your staff. So we will now take attendance. So for those of you on the call today, if you're on your webinar on your computer, please type your name in the chat box. If you have joined us by phone only, please submit your name and organization to achn@medicaid.alabama.gov. Okay, at this time, we will begin the questions and comments segment. At this time, Dr. T will only take questions about the ACHN eBook. So if you have questions regarding the ACHN program, you can email those questions to achn@medicaid.alabama.gov. So now I'll turn this over to Dr. T. So are there any questions regarding the eBook?
Yeah, it will be actually posted on the site. That's what journals. Yeah, the Medicaid website, it will be there. I also welcome feedback if you don't have any questions. Oh, that's the AMA to answer. By tomorrow? Okay. Okay. Yeah, it should be up running within a few days, hopefully this week.
Yes, the recording will be posted to our website under the ACHN Providers tab on the Alabama Medicaid website, along with the ebook.
Hey, Donna? Is that Donna? Hello?
Hi, Dr. T, it's Summer.
Yeah. Hey, a question. Maybe Celeste or Drew can answer this. Can we get this email with a link to all the providers, so they can click the ebook and see themselves?
Hi, this is Celeste Lee Jackson. Thank you, Dr. Steve, for that great presentation, and Amelia, for all of your hard work in this process. We really appreciate it. We appreciate all of your hard work.
Okay, bye, Tina.
Somebody needs to mute their phone. So, Dr. T, we will look into that, and we will let you all know if that is a possible method to access the ebook. So we will have to get with communication to determine that, okay?
Okay, thank you very much. Appreciate it.
Hopefully the ebook will be available to be posted to the website. Hopefully it would be this week. So we do need to touch base with you, Dr. T and Amelia, for a few little modifications that will need to be done. So we'll get those to you today. But as soon as those are done, then it will be available on the website, on Medicaid's website, to access. And like I said, hopefully it would be this week. If it's not this week, it will be probably the earlier part of next week. So just be looking out for that, and you can just check back on the website, like I said, this week or either the early part of next week, and to make sure that you can access it. But this is a great resource for all the providers. Dr. T and NAGCAS spent a lot of time to develop this document, and we really appreciate it. And it was their vision that we are here today, and to help make you all, job a little bit easier, and to put all the information on one site, so you will, have it at hand to you. So thank you so very much.
Thank you very much.
All right, thank you everyone again for your attendance today. Just to remind everyone that this recording, along with the ebook, will be posted to our website under the ACHN Providers tab. There will be a link also that will be emailed to providers. So with the resource, with the ebook. So thank you again, everyone, for your attendance. Thank you so much to Dr. T and to your staff for your time that you put into developing this resource. And so this concludes the ACHN ebook training webinar. So everyone have a great afternoon.
Thank you very much.